Welcome to this special edition of Chai with Molly. We've had the distinct honor of serving you for over a year now, and it has been an exciting experience for us. My team and I, we work very hard to bring you quality shows that bring you information that we feel is necessary and important for you. So if you have something important happening in your community and would like us to be partners with you in covering that event, contact me. 647-979-3220. Or if you'd like to be a guest on our show or would like to advertise with us, we'd love to hear from you. So we have a very, very special guest in our studio with us, so don't go anywhere. We've all heard that smoking is bad for health. There have been all kinds of warnings put out by the government and other agencies to warn us about the hazards of smoking. There are thousands and thousands of people who quit smoking every year. So if you want to be one of them, you don't want to miss my next guest, Catherine Clarke. She is with the City of Toronto Public Health. So thank you for being here.
Thanks for the invitation, Molly.
How easy is it to quit smoking, or is it?
Quitting smoking can be something that's very difficult.
Okay.
Mostly because when people are quitting smoking, they're actually dealing with an addiction and getting over that addiction to nicotine.
Okay. So people who have successfully quit smoking, and we know there are lots of people who have done that, how were they able to do it?
Well, most people do quit cold turkey,
yes,
which is the term that's used for people who use no assistance whatsoever. They kind of tough it out with willpower. But we know that that's very difficult, and we also know that a lot of people return to smoking, and that it may take them 5, 6, 7 tries before they're successful.
So in other words, if somebody's tried to quit and it hasn't worked, they shouldn't give up.
Absolutely. That's the main message of our campaign, is that people shouldn't give up. They should continue to try. And they should look at every slip or relapse as an opportunity to learn something about their smoking habit, and to actually look for the kinds of support and help they can use to deal with those situations and be more successful in subsequent attempts.
All right. So what are some of the mistakes that people do make when dealing with quitting smoking?
Okay. Well, first off, I think a lot of people think of it as just a habit, and certainly we've used that kind of language in the past, that smoking is a habit. And what we want people to understand is that it's an addiction as well as a habit.
Okay.
So getting past the addiction means going through a period of time where the nicotine is actually disappearing from the body.
Okay, so help us understand the medical reasons behind. So what I'm hearing from you is that habit is something that you do, but it's not medical.
Correct. So we're dealing with both an addiction to nicotine, and over time, exposure to nicotine with every cigarette creates changes in the chemistry of our brains.
Okay.
And so the reason why somebody has a second cigarette or a third cigarette is to deal with the drop in nicotine in the brain, the uncomfortableness or the symptoms that are associated with that.
Okay.
And of course, the natural thing to do to deal with those unpleasant symptoms is to replace the nicotine and have another cigarette. So often people will try to quit with very little planning, especially this time of year. You know, there's the pressure to make New Year's resolutions.
Absolutely.
And many people will make a resolution about quitting smoking, but without really getting the facts and looking for support, then people are most likely going to have slips or relapses.
Okay, so someone who is listening to our show right now, and they really want to do this.
Right.
They've tried it in the past, hasn't worked, so this time they want to make it happen.
Right.
What are 3 things that they should do that will improve their chances of success this time around?
Okay. So one thing would be to talk to a healthcare provider, a physician.
So talk to your doctor?
Correct. Or a pharmacist, nurse practitioner, about what it's going to take.
Okay.
And talk about past attempts, where the slips or the relapses have taken place. Has it been with particular people or under certain circumstances? And then develop a plan to deal with those same circumstances or people or situations in a better way.
Help us make a plan for someone who doesn't know how to go about making a plan like this. What should that plan look like?
Well, it can involve, first of all, finding out about medication that might help somebody. So I think most people know about the nicotine patch or gum
I've heard
or
about
inhaler.
that, yes.
Right.
Does that work?
Well, it absolutely helps a lot of people to be successful because it minimizes those symptoms associated with the withdrawal of nicotine.
What is in that patch? There are a lot of people who are concerned about putting things into their body or whatever. So what is in that patch?
Nicotine, the addictive substance.
Okay.
But so what it does is deliver a small amount of the nicotine without the added thousands of other chemicals and particles, which is what actually causes the diseases associated with smoking.
Okay, so now help us understand this. We're trying to get people off nicotine, but now we're putting it back into the system through a patch. How does that work?
Well, first of all, it minimizes the symptoms and the uncomfortableness that comes with quitting.
Because it comes in a controlled dosage?
Correct, a steady controlled dose. And some people will actually use the patch and then either the inhaler or the gum for those times when even the patch isn't enough.
Okay.
So it minimizes the uncomfortableness for the period of time while all of the other changes are taking place.
All right.
A second thing that somebody can do is understand what situations and circumstances and or people increase the level of temptation.
Okay, so sit down and write that.
Correct.
Okay.
It's also helpful to think about what somebody's reasons both for smoking and for quitting are.
Okay.
It's kind of looking at the pros and cons on both sides.
All right.
Because in those difficult moments, it's helpful to think about why I'm putting myself through this.
All right.
We also think it's important for people to talk to their family and friends and ask for support.
Yes, that's important.
Absolutely.
So your family and your friends support you in your decision.
That's right. That's right.
Good suggestion.
And we actually know that people need some support, and we know that people need some good information to make a plan that's likely to succeed.
Okay.
So we've actually put together a little quit kit.
All right.
That we're telling people if they get in touch with us at Toronto Public Health, we can send it out to them through the mail.
Show us that kit. What's included in that?
Well, here's our kit. And we've put some things in it that will help people to minimize their symptoms.
Okay.
So first of all, there's information. Very, very helpful information about what to do in the long term, but also in the short term around managing cravings.
Okay.
Something that we advise people to do when they're having a craving is to hydrate and drink water. So we've given them a stainless steel water bottle.
Oh, that looks pretty.
We also recognize that quitting smoking can be stressful, so we've included a stress ball for squeezing.
Okay. It's supposed to help?
Well,
It does relieve stress?
It can help.
Okay.
We have a little card in here, and we want people to think about their daily smoking. We know that sometimes smoking can be automatic behavior, like we're on automatic pilot, and people might light up at particular times of day or in some situations
and not even realize it.
So there are some cigarettes that people really enjoy in the course of a day, and there might be some that they're doing kind of on automatic pilot.
Okay.
And by rating a pack through the course of the day, people can think about what cigarettes might be the easiest ones for them to give up,
Okay.
which will help them to minimize or reduce the amount that they're smoking.
Okay.
We also have a toothbrush.
How is that supposed to help?
Well, fresh breath, right? It's a much more pleasant sensation having fresh breath than be worried about whether you smell like a cigarette. We have gum, and we have sugarless mints as well.
Okay.
To also help with that mouth sensation.
Okay.
And we also have included information about Smokers Helpline, which is a
Yes.
government-funded service
Okay.
that provides telephone counseling.
Okay.
And the counseling over the phone, there's online services and text messaging service, but the online service is actually available in 100 different languages.
Okay.
So if somebody, they use an interpreter service, but just by saying the name of the language, within seconds, the caller is connected through an interpreter service with the quit specialist and can receive counseling over a period of time for as long as a person needs for just that added
Now, when you
bonus of
call
support.
in, do you speak to the same counselor or different people?
You can work with the same counselor over time, but then, if somebody wants to set up a series of calls with a counselor, they can do that. But if they're having a moment of weakness or some temptation and just want to connect with anybody, they can also call
So
the
what
number.
kind of support can the callers look for when they call this helpline?
Well, again, they'll be advised to talk to their healthcare provider.
Okay.
They'll be advised to think about how ready they are to quit and how much confidence they have that they can quit. So a lot of the counseling is around readiness and getting ready and confidence and building confidence.
And do you recommend that they join maybe a support group or something? Is that something that you recommend?
That will work for some people. For other people, if it means going out in the evening or on the weekend at a time that may not be convenient, that's not necessarily going to be helpful. One of the services that Smokers Helpline offers is an online service. So for anybody who's participated in discussion groups or blogs, they can use the online service as kind of a virtual support group.
Okay, all right. So if there's any additional information that people require, do you have a number where they can call and get
They
that
can
information?
call 416-338-7600 to be connected with a public health nurse or for more information about Smokers Helpline. And if they want a quit kit, they can go to our website, which is on the bag, www.toronto.ca/health, and find a link to ask for one of our quit kits.
Wonderful. So I hope that if this is one of the resolutions that you've made this year, that this information will be helpful either to you or to someone that you love. So thank you once again for being here.
Thank you, Molly, again for the invitation.